Hi, I'm John Lamott from the Central Ohio Area Agency on Aging. Welcome to our series, Medicare for Beginners. In this segment, we will be talking about Medicare Advantage programs or Medicare's Part C program and how it works. Before we begin, here is a brief overview of Medicare. What is Medicare? Medicare is a federal government health insurance program. It provides coverage to persons who are age 65 and older, and also younger persons who may be receiving Social Security disability benefits, or persons who have end-stage renal disease which requires dialysis or a transplant. Medicare recipients must be a U.S. citizen or an individual lawfully admitted for permanent residence into the United States who has resided in the United States continuously during the 5 years preceding the month of the application for Medicare. There are two options for Medicare coverage: Original Medicare, which includes Medicare Parts A and B, or a Medicare Advantage plan. There are additional video sessions like this one that will provide information about Medicare A and B. Medicare Advantage, which is also known as Medicare Part C, is an alternative to Original Medicare. Medicare Advantage includes hospital, medical, and prescription drug coverage, all under one plan and one provider. Medicare Advantage plans are offered by private companies who contract with Medicare. Examples of Advantage plans would include a health maintenance organization, or HMO, and a preferred provider organization, or a PPO. These types of plans will include a network of providers and may have deductibles, co-pays, and monthly premiums for services provided. These out-of-pocket costs can vary by plan. Medicare Advantage plans are required to offer the same coverages, rights, and protections that are provided to those on Original Medicare. However, many plans will also offer additional benefits not covered by Original Medicare, but possibly at an additional cost. Some examples of these would be dental and vision coverage. In addition, some plans may offer value-added benefits at no additional charge, such as a free health club membership, such as silver sneakers, or pharmacy credits for over-the-counter items. Medicare beneficiaries who are interested in joining a Medicare Advantage plan must be enrolled in both Part A and Part B and live in the Advantage plan service area. There are no age or medical restrictions to join an Advantage plan. You can enroll in Medicare and select an Advantage plan during the 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after your 65th birthday. You can also join, switch, or drop a Medicare Advantage plan during the annual Medicare open enrollment period, which occurs each year from October the 15th to December the 7th. Coverage would then begin on January 1st. Choosing the right Medicare Advantage plan is a very important decision. Because these are managed care plans and have provider networks, beneficiaries should check with their doctors, hospitals, home medical equipment providers, and any other medical providers they use to find out which Advantage plans they are in network with. This will help ensure that the beneficiary will enroll in a plan that allows them to continue to see the doctors and other medical providers they are accustomed to using. In addition, those who travel or spend extended time away from home, such as snowbirds who leave Ohio and go to Florida for the winter, may want to consider a plan with a nationwide network of providers. To learn more about Medicare, we invite you to attend one of our free Medicare for Beginners programs held monthly at COAAA. Look for other segments in this series where we will discuss the other parts of the Medicare program. There are also resources on our website, www.coaaa.org.
The Central Ohio Area Agency on Aging supports people as they navigate the experience of aging or disability. We connect people with services that help keep them safe and healthy at home, such as homemaking assistance, transportation, home-delivered meals, and personal care. We offer education and resources to caregivers, professionals, and the public, and advocate for programs and policies that benefit older adults and individuals with disabilities.